Two giants in healthcare insurance, one big question: which provider truly has your back? On one side, the established industry leader, Cigna; on the other, the fast-growing contender, Molina Healthcare. Forget the marketing lingo, we're digging into what really matters. Each round will award points based on the factors that count, and by the end, you'll know which provider comes out on top. And the winner may just surprise you. Okay, quick roadmap before we get lost in the details. Here what we're comparing. First up, pricing and value, then provider network, digital experience, plan variety, member satisfaction, and, oh, this is interesting, local versus global presence. Sound good? Alright, let's jump right in. Let's talk pricing and value. Cigna's got a lot going on here, like loads of plan options, and they're pretty competitive if you get insurance through work. But honestly, if you're buying an individual plan or you're on the marketplace, oof, the costs can creep up there. Now, Molina, it's kind of a win for your wallet, especially if you're low income or looking for Medicaid options. Super affordable, plus out-of-pocket limits are lower, that means less surprise bills. Downside: not much variety outside the Medicaid lane. So yeah, Molina actually comes out on top for bang for your buck here. Alright, next, provider network. Cigna's flexing hard here, not gonna lie. We're talking a huge national and even international network, tons of specialists, but you do have to stick within network docs to get the best coverage. Molina's network? Super strong if you're in state and on Medicaid, but if you travel a lot or move out of state, just know your options kind of dry up. So for access and network strength, Cigna's taking the win. Switching gears to digital experience. Cigna, honestly, their app's pretty slick. Everything from telehealth to digital ID cards is there. Once in a while you might hit a snag or a glitch, but overall solid. Molina, their app and website are decent, and you can get telehealth on some plans, but it's not quite as fancy or smooth. Plus, the customer portal can lag sometimes, which, right? So yeah, Cigna wins the digital showdown. Oh, and here's something cool I bet you didn't know. Molina Healthcare actually started in just one little clinic out in Long Beach, California back in 1980. Crazy how it's grown, right? Now, plan variety, this one's kinda wild. Cigna just brings it all: employer plans, marketplace, even global coverage if you somehow end up in, I don't know, Belgium. About the only drawback is some regions might see fewer plans, but it's still way more than most. Molina's basically focused on Medicaid and a bit of Medicare here and there. Private employers, almost non-existent. Easy win for Cigna. Let's get into quality and member satisfaction. Cigna scores pretty well here, solid ratings, fewer complaints, but sure, some areas get a little mixed feedback from members. Molina, people tend to like them where they offer Medicaid, but there are some places where complaint levels are higher and reviews bounce all over the map. So for consistency, Cigna edges out Molina here. Last big thing, local versus global presence. So Cigna is literally everywhere, all 50 states, even internationally, which is kinda wild for an insurer. Molina, on the other hand, sticks to certain states but goes all in on Medicaid there. If you want global reach or you move a lot, only one winner here, it's really Cigna. So looking at all the big categories side by side, you can really see where Cigna flexes: broad coverage, plan variety, digital features, while Molina shines on affordability, especially for Medicaid. The radar chart really kind of draws that picture for you. Okay, final thoughts time. If you're hunting for options and you want a plan that's gonna be there whether you're in New York, Texas, or anywhere else they can probably cover you, Cigna's the obvious choice. But if you're looking for low-cost, no-frills coverage and you're eligible for Medicaid in a Molina state, honestly, it's a hard deal to beat. Just depends on what you need. If you found this breakdown helpful, stick around and hit that follow or subscribe, because you do not want to miss what's coming up next.